Delirium is a change in mental state. It is also known as an acute confusional state. What that means is that your brain might be impacted by something physical. So you might have a different level of consciousness, you might be more drowsy, more alert than normal, you might be more agitated, and it is caused by something that's going on physically.
So we're not entirely sure what the science is behind why someone actually gets the delirium when they're poorly, but we do have some causes that we can chalk it up to. So that includes pain, includes infection, dehydration. If someone has a change in their medication, certain medications can cause it, and sometimes even something as simple as a change in environment can cause a delirium. So there are multiple risk factors that can make somebody more inclined to suffer from a delirium. This can include advanced age, if someone's quite frail, if someone's on multiple medications or have multiple medical conditions at once, and even little things such as like sleep deprivation, or if you're not eating or drinking enough, can increase your risk of getting a delirium.
There are two different types of delirium. We have what we call hypoactive delirium, which means that you're more likely to be sleepy, drowsy. The opposite is hyperactive, and that's where somebody is likely to be more agitated, a little bit more anxious, more driven with behaviour. You might see somebody trying to leave the building, for example, or trying to get out. We also have another type of delirium which is called mixed delirium, so that's when the person can flip between the two, so they can be really agitated and distressed one moment, and then a couple of hours later or an hour later they might be very withdrawn and sleepy. No, delirium isn't the same as dementia. It can look very similar though in terms of symptoms. So delirium is what we call an acute confusional state. So it means that it comes on acutely, so it comes on really quickly. The person can change very quickly, but it is actually reversible. If we can understand what the causal factors are, we can look to treat it and reverse it. People with delirium can have delirium for a short period of time, days, months. Sometimes it can last longer. Dementia is not reversible, it's a progressive condition, and we don't have a cure for dementia, so they are very different but can look similar in symptoms. In the Trust, we use the single question in delirium, which is, are they different today? So we asked our staff and team members to ask our patients and look at our patients and think, are they behaving differently? Are they doing something different? Are they more confused, more agitated, more paranoid? Are they more sleepy, drowsy, less awake than normal? In order to ask this question and to answer it effectively, we need to know who they are, which means we heavily rely on getting to know our carers and patients' families. So we need to involve them in this process and understand that we have some collateral and know who our patients are.
Yes, all medications can cause delirium. Medications that can cause delirium might include medications for pain, medications that you might use that are sedative in nature. If you suspect that medications are causing delirium, I would advise that all medications be reviewed as quickly as possible. Treatment for delirium isn't always straightforward. There are many causes of delirium. If you notice a change in your loved one and suspect a delirium, I would advise going and seeking support from your healthcare professional who can advise on these causes. Delirium is entirely reversible and is preventable. If we can find the causes and spot delirium, then we can reverse delirium far sooner. Supporting people with delirium is everyone's responsibility, and that's all staff members within the Trust. I would also utilise any family members to help support that person if they're in hospitals and they're particularly distressed. Supporting people with delirium is everybody's business. Yes, absolutely, prevention is entirely key. If you want more advice or support around delirium, then I would advise going and speaking to a healthcare professional. If you're requiring more support and advice about delirium, head straight to our website under D, Dementia and Delirium. You can find more information and support there.